Coronavirus 2019 ncov. In this video, you can find information and guidance from WHO regarding the current outbreak of novel coronavirus 2019 ncov that was first reported from Wuhan, China, on the 31st of December 2019. WHO is working closely with global experts, governments, and partners to rapidly expand scientific knowledge on this new virus, to track the spread and virulence of the virus, and to provide advice to countries and individuals on measures to protect health and prevent the spread of this outbreak. Advice for the public. Basic protective measures against the new coronavirus. Wash your hands frequently. Wash your hands frequently with an alcohol-based hand rub or soap and water. Why? Washing your hands with an alcohol-based hand rub or soap and water kills the virus if it is on your hands. Practice respiratory hygiene when coughing and sneezing. Cover mouth and nose with flexed elbow or tissue. Discard tissue immediately into a closed bin and clean your hands with alcohol-based hand rub or soap and water. Why? Covering your mouth and nose when coughing and sneezing prevent the spread of germs and viruses. If you sneeze or cough into your hands, you may contaminate objects or people that you touch. Maintain social distancing. Maintain at least 1 meter (3 feet) distance between yourself and other people, particularly those who are coughing, sneezing and have a fever. Why? When someone who is infected with respiratory diseases, like coronavirus 2019 ncov, coughs or sneezes, they project small droplets containing the virus. If you are too close, you can breathe in the virus. Avoid touching eyes, nose and mouth. Why? Hands touch many surfaces that can be contaminated with the virus. If you touch your eyes, nose or mouth with your contaminated hands, you can transfer the virus from the surface to yourself. If you have fever, cough and difficulty breathing, seek medical care early. Tell your healthcare provider if you have traveled in an area in China where coronavirus 2019 ncov has been reported, or if you have been in close contact with someone who has traveled from China and has respiratory symptoms. Why? Whenever you have fever, cough, and difficulty breathing, it's important to seek medical attention promptly, as this may be due to a respiratory infection or other serious condition. Respiratory symptoms with fever can have a range of causes, and depending on your personal travel history and circumstances, coronavirus 2019 ncov could be one of them. If you have mild respiratory symptoms and no travel history to or within China. If you have mild respiratory symptoms and no travel history to or within China, carefully practice basic respiratory and hand hygiene and stay home until you are recovered, if possible. As a general precaution, practice general hygiene measures when visiting live animal markets, wet markets or animal product markets. Ensure regular hand washing with soap and potable water after touching animals and animal products. Avoid touching eyes, nose or mouth with hands, and avoid contact with sick animals or spoiled animal products. Strictly avoid any contact with other animals in the market, e.g., stray cats and dogs, rodents, birds, bats. Avoid contact with potentially contaminated animal waste or fluids on the soil or structures of shops and market facilities. Avoid consumption of raw or undercooked animal products. Handle raw meat, milk or animal organs with care, to avoid cross-contamination with uncooked foods, as per good food safety practices. What is coronavirus? Coronaviruses are a large family of viruses found in both animals and humans. Some infect people and are known to cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). What is a novel coronavirus? A novel coronavirus (CoV) is a new strain of coronavirus that has not been previously identified in humans. The new, or novel, coronavirus, now called coronavirus 2019 ncov, had not previously detected before the outbreak was reported in Wuhan, China in December 2019. Is the new virus the same as SARS? No, coronavirus 2019 ncov is from the same family of viruses as Severe Acute Respiratory Syndrome (SARS-CoV), but it is not the same virus. How dangerous is it? As with other respiratory illnesses, infection with coronavirus 2019 ncov can cause mild symptoms including a runny nose, sore throat, cough, and fever. It can be more severe for some persons and can lead to pneumonia or breathing difficulties. More rarely, the disease can be fatal. Older people and people with pre-existing medical conditions such as diabetes and heart disease appear to be more vulnerable to becoming severely ill with the virus. Can humans become infected with the coronavirus 2019 ncov from an animal source? Detailed investigations found that SARS-CoV was transmitted from civet cats to humans in China in 2002 and MERS-CoV from dromedary camels to humans in Saudi Arabia in 2012. Several known coronaviruses are circulating in animals that have not yet infected humans. As surveillance improves around the world, more coronaviruses are likely to be identified. The animal source of the coronavirus 2019 ncov has not yet been identified. This does not mean you can catch coronavirus 2019 ncov from any animal or from your pet. It's likely that an animal source from a live animal market in China was responsible for some of the first reported human infections. To protect yourself, when visiting live animal markets, avoid direct unprotected contact with live animals and surfaces in contact with animals. The consumption of raw or undercooked animal products should be avoided. Raw meat, milk or animal organs should be handled with care to avoid cross-contamination with uncooked foods, as per good food safety practices. Can I catch coronavirus 2019 ncov from my pet? No, at present there is no evidence that companion animals or pets such as cats and dogs have been infected or have spread coronavirus 2019 ncov. Can the coronavirus 2019 ncov be transmitted from person to person? Yes, the coronavirus 2019 ncov causes respiratory disease and can be transmitted from person to person, usually after close contact with an infected patient, for example, in a household workplace, or health care center. What can I do to protect myself? Stay aware of the latest information on the outbreak, available on the WHO website, and take care of your health by doing the following. Wash your hands frequently with an alcohol-based hand rub or soap and water. Why? Washing your hands with an alcohol-based hand rub or soap and water kills the virus if it is on your hands. Maintain social distancing. Maintain at least 1 meter (3 feet) distance between yourself and other people, particularly those who are coughing, sneezing and have a fever. Why? When someone who is infected with respiratory diseases, like coronavirus 2019 ncov, coughs or sneezes, they project small droplets containing the virus. If you are too close, you can breathe in the virus. Avoid touching eyes, nose and mouth. Why? Hands touch many surfaces that can be contaminated with the virus. If you touch your eyes, nose or mouth with your contaminated hands, you can transfer the virus from the surface to yourself. If you have fever, cough and difficulty breathing, seek medical care early. Tell your health care provider if you have traveled in an area in China where coronavirus 2019 ncov has been reported, or if you have been in close contact with someone who has traveled from China and has respiratory symptoms. Why? Whenever you have fever, cough, and difficulty breathing, it's important to seek medical attention promptly, as this may be due to a respiratory infection or other serious condition. Respiratory symptoms with fever can have a range of causes, and depending on your personal travel history and circumstances, coronavirus 2019 ncov could be one of them. If you have mild respiratory symptoms and no travel history to or within China, carefully practice basic respiratory and hand hygiene and stay home until you are recovered, if possible. Should I wear a mask to protect myself? Wearing a medical mask can help limit the spread of some respiratory disease. However, using a mask alone is not guaranteed to stop infections and should be combined with other prevention measures, including hand and respiratory hygiene and avoiding close contact, at least 1 meter (3 feet) distance between yourself and other people. WHO advises on the rational use of medical masks, thus avoiding unnecessary wastage of precious resources and potential misuse of masks. This means using masks only if you have respiratory symptoms, coughing or sneezing, have suspected coronavirus 2019 ncov infection with mild symptoms, or are caring for someone with suspected coronavirus 2019 ncov infection. A suspected coronavirus 2019 ncov infection is linked to travel in an area in China where coronavirus 2019 ncov has been reported, or close contact with someone who has traveled from China and has respiratory symptoms. How to put on, use, take off and dispose of a mask. Before putting on a mask, wash hands with alcohol-based hand rub or soap and water. Cover mouth and nose with mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water. Replace the mask with a new one as soon as it is damp, and do not reuse single-use masks. To remove the mask, remove it from behind. Do not touch the front of the mask. Discard immediately in a closed bin. Wash hands with alcohol-based hand rub or soap and water. Who can catch this virus? People living or traveling in an area where the coronavirus 2019 ncov virus is circulating may be at risk of infection. At present, coronavirus 2019 ncov is circulating in China, where the vast majority of people infected have been reported. Those infected from other countries are among people who have recently traveled from China or who have been living or working closely with those travelers, such as family members, co-workers or medical professionals caring for a patient before they knew the patient was infected with coronavirus 2019 ncov. Health workers caring for persons who are sick with coronavirus 2019 ncov are at higher risk and must protect themselves with appropriate infection prevention and control procedures. People living outside of areas in China where the virus is circulating are not at risk of infection with coronavirus 2019 ncov. WHO is continuously monitoring the epidemiology of this outbreak to better understand where the virus is circulating and how people can protect themselves from infection. Who is at risk of developing severe illness? While we still need to learn more about how coronavirus 2019 ncov affects people, thus far, older people and people with pre-existing medical conditions such as diabetes and heart disease appear to be more at risk of developing severe disease. How does this virus spread? The new coronavirus is a respiratory virus that spreads primarily through contact with an infected person through respiratory droplets generated when a person, for example, coughs or sneezes, or through droplets of saliva or discharge from the nose. It is important that everyone practice good respiratory hygiene. For example, sneeze or cough into a flexed elbow, or use a tissue and discard it immediately into a closed bin. It is also very important for people to wash their hands regularly with either alcohol-based hand rub or soap and water. How long does the virus survive on surfaces? It is still not known how long the coronavirus 2019 ncov virus survives on surfaces, although preliminary information suggests the virus may survive a few hours. Simple disinfectants can kill the virus, making it no longer possible to infect people. What's the difference between illness caused by coronavirus 2019 ncov infection, the flu or a cold? People with coronavirus 2019 ncov infection, the flu, or a cold typically develop respiratory symptoms such as fever, cough, and runny nose. Even though many symptoms are alike, they are caused by different viruses. Because of their similarities, it can be difficult to identify the disease based on symptoms alone. That's why laboratory tests are required to confirm if someone has coronavirus 2019 ncov. As always, WHO recommends that people who have cough, fever and difficulty breathing should seek medical care early. Patients should inform health care providers if they have traveled in the 14 days before they developed symptoms, or if they have been in close contact with someone who has been sick with respiratory symptoms. How long is the incubation period? The incubation period is the time between infection and the onset of clinical symptoms of the disease. Current estimates of the incubation period range from 2 to 11 days, and these estimates will be refined as more data become available. Based on information from other coronavirus diseases, such as MERS and SARS, the incubation period of coronavirus 2019 ncov could be up to 14 days. Can coronavirus 2019 ncov be caught from a person who presents no symptoms? Understanding the time when infected patients may spread the virus to others is critical for control efforts. Detailed medical information from people infected is needed to determine the infectious period of coronavirus 2019 ncov. According to recent reports, it may be possible that people infected with coronavirus 2019 ncov may be infectious before showing significant symptoms. However, based on currently available data, the people who have symptoms are causing the majority of virus spread. Has the WHO, World Health Organization, changed its advice on health protection? No, our advice is the same. WHO has issued advice to people on how to protect themselves from coronavirus 2019 ncov infection, as for any virus that spreads via the respiratory route. In addition, it is vitally important in healthcare settings that healthcare workers are able to protect themselves from infection. Is it safe to receive a package from China or any other place where the virus has been identified? Yes, it is safe. People receiving packages are not at risk of contracting the new coronavirus. From experience with other coronaviruses, we know that these types of viruses don't survive long on objects, such as letters or packages. Are antibiotics effective in preventing and treating the coronavirus 2019 ncov? No, antibiotics do not work against viruses, they only work on bacterial infections. The novel coronavirus is a virus and, therefore, antibiotics should not be used as a means of prevention or treatment. Are there any specific medicines to prevent or treat coronavirus 2019 ncov? To date, there is no specific medicine recommended to prevent or treat the novel coronavirus. However, those infected with coronavirus 2019 ncov should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. WHO is helping to coordinate efforts to develop medicines to treat ncov with a range of partners. If you want to protect yourself from getting infected with the new coronavirus, you should maintain basic hand and respiratory hygiene, and safe food practices and avoiding close contact, when possible, with anyone showing symptoms of respiratory illness such as coughing and sneezing. The following measures are not specifically recommended as coronavirus 2019 ncov remedies as they are not effective to protect yourself and can be even harmful. Taking vitamin C, smoking, drinking tradition herbal teas, wearing multiple masks to maximize protection, taking self-medications such as antibiotics in any case. If you have fever, cough and difficulty breathing, seek medical care early to reduce the risk of developing a more severe infection, and be sure to share your recent travel history with your healthcare provider. Novel coronavirus 2019 ncov. Worldwide, 638,146 cases. The United States of America, 103,321 cases. Italy, 92,472 cases. China, 82,356 cases. Spain, 72,248 cases. Germany, 52,547 cases. Iran, the Islamic Republic of 38,309 cases. France, 37,145 cases. The United Kingdom, 17,093 cases. Switzerland, 13,152 cases. Netherlands, 9,762 cases. Thanks for watching this video. If you like this video, click on like button. If you want to watch more videos like this, click on the subscription button below, it's free subscription.